Specifically underneath the clavicle, more towards the
It's
center, or all along that?
all along there. Some people have different locations, and so you're trying to find out where along that it hurts or has a little pain. When we're doing a breast cleansing, the breast is using that lymph node to get out through the axilla or the underarm. If it's swollen, the metal salts can't get out. So we start just like the nozzle of a hose, the armpit, the nighttime detox deodorant. And once we know that's open, then we will take the Sentinel Breast Cream right to the edge of the underarm and spread it right over to the point on the left and right. Usually it's on the non-dominant side, but it can be both. I have people stop until that pain dissipates. Sometimes because of the calcification that has developed because of the metal salts in that lymph node, the Sentinel Breast Cream first to dissolve the calcification, the calcium.
When I was doing body talk, we learned traditional Chinese medicine, and then you have point 22 or 23 that's on the side here. So we'd have people take their thumbs on the side, and if they were tender there,
Yeah.
then usually that was something like a gallbladder issue. So do you find where women have the bras that wherever if they have a soreness anywhere, that is a lymph blockage?
Because they have maybe used a deodorant or they've been in a car accident and they've had the seat belt across, can't use their lymphatics very well because it's so well, they're ripped or restricted. We don't know why, but we can see the backup in thermography. And I actually have to have them use a breast cream just to excrete through the skin. They can keep using that over their body and it will keep moving it out. So we don't have to use the underarm. But the problem is with their underarms not working as well, they can have fog brain, all sorts of things, because the brain drains down behind the teeth, down the neck to the underarm. This is a lymphatic issue that's not being addressed.
Do you find that there's a correlation too with like TMJ and jaw pain?
Yeah, a lot of times people will have from an accident twisted or something because they have so much blockage and calcification in the neck.
Chiropractors will they'll address and talk about subluxations of a neck twist or a back. And so basically anywhere along the vertebrae where there is a subluxation, it can block lymph.
It can. And it can be done with a chemical like gadolinium or anything. As we were saying about gadolinium, it will actually cause the spinal cord to sink. It'll spread calcification on the lower back. People have trouble, with their lower back. It can affect their kidneys. The lymphatics, when they retain fluid, the expansion of the fluid will throw off the muscles and nerve endings and everything. Like going back to the 7 steps, why we do it is because as we're working up the knees and that I have people palpate their hip point. If that's sore, that means the fluid's not getting down to the bottom of the feet, and that fluid is pushing on their nerve endings. It's a very simple thing that they can self-manage themselves. It may take them 5 or 6 months. We have a lot of chiropractors that use the 7 steps because it makes your job much easier to put the bones back into place or to readjust the muscles. Because when you got all this fluid, people are going back every week, and they're for adjustment, they're not getting results.
That's exactly what was in my awareness. People can think that they're getting an adjustment at a chiropractor, yet is it true that until we start detoxing these metals and like the aluminum salts from the lymph nodes on the along the spine or near the spine, that it's not going to hold. It's going to always kind of go back to a self-protective state trying to detox.
Retaining these metals because you have a lot of aluminum salts that are there. The aluminum's causing, it's osteoblastic, causing the bone to decalcify because that's what aluminum does. It's caused like rickets.
Aluminum pulls calcium from the bones.
Yeah. People say, well, just take calcium. I say, you don't just take calcium because cows don't take calcium. Cows eat the grass, they get their potassium, and they have a salt lick, which is an iodine salt lick. And so it's iodine and actually magnesium from the grass that form the milk. When I see somebody is losing calcium, especially women because they're more acidic, I said, well, the study on children when they gave one set of children calcium, the other set of children magnesium, the ones that had magnesium had bone growth. The other ones didn't have any bone growth. The women all the time, iodine, magnesium, keep those ends up, and zinc.
How could we describe to somebody who's not really familiar with thermography what these color spectrums indicate?
The white is very highly inflammatory.
What is it measuring specifically in the tissue or the blood, or what is the
It's heat.
thermography technology reading?
These are heat signatures emitting through the skin. And so what happens, white, and it goes into red and then yellow. And you want more of the blues and the greens. When they're looking at a pipe, they're looking at the heat signature of a pipe, or they're looking where, like, where's your house losing heat? Because it'll show up through the cracks. The same thing we're using here is that we're studying about what's affecting the lymphatic system. So that is these atoms collecting. These were loopy earrings.
We can even see on the upper right the circles near your
Right.
ears, and then on the lower left, there's no circles, no earrings being worn.
And the same thing will show up with some dental issues that people have had who went to the dentist. So here's where the earrings are, what they did to the body. Somebody kept them on for the first month, the second month, the third month, somebody figured in the technician said, you got to take them off. So that's a month. You see how blue it is? There's a little residual there, but see the difference? It's just wearing earrings, how earrings can affect the body. And people went to the dentist and they say, oh, I had my amalgam taken. I don't, it shouldn't be any. And then it shows up they have a cavitation problem, and that can affect the breast or root canals. Root canals are one of the worst things for the breast. I've seen more breast problems because of the root canals. It's not easy for a dentist to digest that one. On the left upper is the first picture, and you see how inflammatory that is. We know something's coming from up above, but we're not sure. But you see how these metal salts come down, and they get into the liver, they get into all over the place. And the next one on the upper right is where the product is working really good, the Sentinel Breast Cream and the Nighttime Detox Deodorant. The third one, lower left, we've got it cleared, but we still have things coming. So we have a source that hasn't been panned out. So when we were doing this, we wanted them to raise it up, and we actually wanted the earrings that they refused because your clinical's only on this, not on earrings. The one on the right, they said, well, your product doesn't work. Well, we had these people keep diaries, and they had to write every day what they did, what they used, what activity. We found out this person was supposed to come in on a Friday, but because she had a bike marathon in Eastern Washington, they let her do the bike marathon. Well, apparently she was wearing her earrings during the bike marathon, and this is what happens with some earrings. So you see on the lower right how red the armpits, the upper armpit is. That's coming from the head, and the disbursement through the whole body. That's what metal salts, how dangerous. So when you do exercises, take the earrings off. Even drinking wine, it's very acidic. It actually invokes the metal salts.
Are there any type of earrings that are safe? Because some, jewelers and stuff will say, oh, sterling silver is more pure,
Yeah,
or like hypoallergenic is better. Is there really a
yeah.
difference between all these metals?
A lot of them are mixed metals. Gold's a good ground. So you hold a cell phone, it's going to ground.
People have any type of earrings, gold would be the best choice.
That would be the choice, yes. This is the placebo. The body didn't change on this person. So there's no change. These were products that didn't have any ingredients in them. They were just a moisturizer. So this establishes the fact that in 3 months, nothing happened.
So what would be the difference? Because I'm familiar a little bit with this is like a sugar pill, or
Correct.
they have done mock surgeries on knees with people, and their knee pain sometimes has got better. And Joe Dispenza is one of these authors who kind of talks about this. What is it about this placebo where they just didn't believe that it would work, or they weren't informed that there's
No,
ingredients?
you cannot, in a clinical, you don't know which person It's on the placebo till after the clinical. Even the people that are doing the clinical, the third party, because we are just sponsoring, even though I had to go in and say, hey, folks, we're not doing mammogram. We're raising that candle. And then I want a side picture. I want the arms up. And they said, well, we don't do it that way in thermography. And I said, I know you don't do it that way. We're paying and we want to be able to establish because you've already shot the earrings. So let's raise it up. So the technician was very nice to take extra pictures for us to establish that. And this has made inroads into thermography now. And that's why they ask people now, are you left or right-handed when you go in for mammograms? So all this stuff kind of got swept up into the medical world, which is good. We should all be working together, but you'd be surprised. We've been in hospitals and I've talked to the oncologists and I've talked to the heads. When I mentioned the word thermography, they said, sorry, bye-bye, we're gone. We don't do that here.
Even though it's a technology that's well established and you can get data from it.
Well, they said it's not scientific enough for them. And the problem with mammograms is that you have a lot of salts, metal salts. The chemical reaction is when you get radiation from a mammogram and you don't know if it's 0.5, 1.0, because these are aluminum filters to focus on what they're trying to see, and they have to do it again, that causes calcification. That's how the body gets rid of radiation. Now you have these narrow lymphatic vessels are full of calcification, and you sent the woman home, and she's blocked from the mammogram, and it hurts. And so women don't want to get a mammogram. We sent out third party. This is when people say we don't have any aluminum or we have our aluminum's not, it's different. The crystal cell deodorants, they all belong in the aluminum family. We had this done. It's calculated out. We know to test a product and you have it done. If you go to a gemologist, they're going to test a stone to see what's in it. Well, the gemologist took all these different deodorants, found out they belong in the aluminum family, so they can't hide.
What technology are they using here?
They use spectrometry to analyze, and these are what you're seeing, that one bleep says these are in the aluminum family. I sent all these deodorants to a gemologist who does gems to make sure they're authentic. And he said, oh, no, these are in the aluminum family. They all have aluminum in it. So they can't really say that it is because no aluminum not only is not beneficial or is safe, and so there's no such thing as safe aluminum in any degree. I know they use it in vaccines. The amount, in fact, you'll find how much is in medicine. And Nurse Linda here looked at that slide and said, I cannot believe they stopped 1987. The FDA stopped looking at aluminum in medicine. It was too plentiful. They didn't want to investigate any further because how do you take aluminum out? Because they say it's in the soil, it's natural, so we're not going to do anything about it.
Their justification is it's a natural element, so therefore there's nothing to look into.
But in a human, it's unnatural. It's our kryptonite. That's the effect on the thyroid. That's what earrings can do. So we believe it can infiltrate the thyroid by dental disturbances in earrings.
People who have hypothyroidism, earrings could be a contributing factor to this.
Yeah, they can, because the thyroid absorbs a lot of heavy metals, and because they block the underarm. You can see this person, you can see the thickness of the neck. The two wings on the thyroid expand. When I see somebody and they have in their neck two creases and in between is a bulge, I know they have a thyroid problem. I'll go, well, you're on an antiperspirant crystal deodorant, and they're probably wearing earrings. And so we can solve that situation by using the nighttime deodorant and work it up into the neck and draining it.
Dental, nose rings, eyebrow rings, any kind of piercing in the mouth, tongue, lip.
And sometimes they can get radiation from the hospital, from a test where they did the scan and they raised it up too high. They don't tell you that you can be affected by some of these tests in the hospital. When we have people on the breast cream and the nighttime detox deodorant, any cancer goes to the liver. The radiologists were saying, does breast cancer start in the breast first or in the liver. We always have the belly fat freedom over the liver to take out any metal salts, especially aluminum, through the skin. So the best way to clean the liver initially is topically because the lymphatics are against the stomach walls. And so if we can put it topically, we can get the lymphatics of the liver. It's attracted to the outside of the skin. And so we can diffuse the liver of the heavy metals. That is a real problem. And here's a lady on this one. She was in a car accident where the seatbelt actually affected her drainage in the breast. And so it's kind of dead tissue. And so she doesn't have anything to worry about. But people wanted to do biopsies, they wanted to do everything. She went to a doctor in California, and doctor said, no, this is just kind of dead tissue. But it kind of verified that people can get scared into doing something where they shouldn't. This is where we try to where women can use these products and get rid of the anxiety because they're self-managing, doing something about themselves. And there's a Sentinel Breast Cream. Yeah, it comes in different sizes. I always like to use the skin first because when the skin's not excreting, it's just backing up. And people doing internals like charcoals and other internal detoxes, they'll just work against what I'm doing because I'm pulling things through the skin and they're using an internal at the same time. They're pulling back in and recirculating the heavy metals. The accumulation of transition metals in the breast tissue may be closely related to malignant growth process. This says it all. The accumulation of nickel, iron, chromium, zinc, cadmium, lead. What's missing in this? It's aluminum, the third most abundant element on Earth. They didn't test. Why? I don't know. Now we're going to be getting into understanding the elements within the body. If you leave heavy metals in the body, they're just going to accumulate and they're going to affect the test, even in the medical world. Pretty much the breast drains through the armpit. Okay, that's lymphatic. That's an open system to me. When you close it with a deodorant or dental issues or earrings, something that caused it like a car accident or falling off a horse, you altered the system. And so now you have to go right over the organ to keep the lymphatics moving. I'm on LinkedIn all the time telling people, what is breast density? I'll show them what it is on the Oligoscan. As we get there, it's the accumulation of heavy metal. So you match the scientific study, what's in the tumors, to what's in the Oligoscan. It should make sense to people. I mean, you're laughing, Nathan, but I'm talking to people
who have PhDs.
PhDs, and you're questioning their chairmanship or their education. 23 years working with neurosurgeons, I'm not afraid to confront them. So they'll ignore me until it happens to somebody in their family, or even better, if it's a male and they have a prostate problem and they're a doctor, and I'll tell them how it developed because their lower legs weren't draining the lymphatics, so it accumulated in the prostate. I have a great letter here back from the prostate research group, and they said nobody's interested in aluminum as studying for prostate, and nobody cares. Biopsies are really bad because then the drainage field for the breast is usually cut off, including the thyroid. At that point, I have to have people topically detox every day because the biopsy because they don't use thermography or they don't use the Oligoscan, they can say, well, there's nothing there that proves that. Well, of course, this just talks about the length of the sweat ducts. People who run because they build up those ceramides that we were talking about in the previous discussion, is that as it expands, those sweat ducts have to expand too. And so a lot of people who are running also have knee problems, unknown knee problems. They have to stop running. It's because they have not figured out how to reestablish the sweat ducts in their feet. And a lot of times they're hitting with their heel and you're supposed to slide over the entire feet. Well, when you hit like this, you're affecting your fluids all the way up your spinal cord.
I mean, I remember being aware that running on concrete was not good at all for the knees. And then in Arizona, I would run in mountain trails And then eventually realized even that was no different than running on concrete, and then moved to treadmill, where at least there's some bounce, and then
Right.
eventually just kind of do more of a rebound trampoline now.
But now that if you have the healing soles and you wear it and you're wearing the belly cream up the first step around the knee, you're draining that compaction. When you get, the soreness will go away, will dissipate. Because when you're running, you're sweating. And when you finish, doesn't mean that body doesn't get rid of waste. It needs to get rid of that. That's why I have people like put the moisturizer on, put on our products so you can continue detoxing, so you don't have that pain that, like, well, now I can't even run dirt roads.
We've kind of been misled because lotions have parabens and all these different things in
Right.
them. And
Yeah.
so people think that they're moisturizing their hands and their feet or their elbows or arms with lotion. And really, it's just clogging and stopping the lymphatics and being able to detox these metals.
Well, that's when you switch to a petroleum or synthetic chemicals because they're cheap and you can put a nice perfume in it and somebody says, in their mind, they think it's working, but you're absorbing all these chemicals within the body. I mean, I just read somebody says, I don't use anything in my face. I don't use makeup. And growing up in LA, I used to see these newscasters and they would wear all this makeup. The cameras start to move back further and further away because all those heated lamps are causing the wrinkles and the aging of the skin.
The light is reacting with the chemicals in the makeup, and that I would guess that that's another factor along with earrings and fillings, that having makeup on your face over time is blocking lymph too.
Yeah, yeah, probably 20 years ago. I'm in a room and we're talking about the chemicals and makeup. She says, well, my two sisters wore makeup their whole life, used everything. I never used it. They both died of cancer.
People who have detoxed, they get the metals out, they get a Oligoscan with us, they use these products, they start to detox. Do they even need makeup at that point?
If you get get rid of the heavy metals and you're eating good, you're not eating a lot of processed foods. Liz is older than I am. The makeup she uses is geranium moisturizer. I make bar soap and it's made out of olive oil. So everything's natural. And when we go to conferences, people say, you have such nice skin. Well, she's not putting makeup on. I mean, maybe liner there. Aluminum and sweat. That's where your lumen comes out to the body sweat. This was done by Dr. Exley, who I know that did my study on the nighttime detox deodorant. He did college students. I said, well, you just did college students. Did you do any people that were older, like in the 50s and 60s and 70s? And he goes, no, why? And I said, well, I want to see the absence of aluminum in human sweat. He didn't get it. And when you challenge a person who's one of the top aluminum scientists in the world, they don't like it.
Over time, people will have their identity fused with their accolades. And if the accolades are challenged, then they consciously or subconsciously think they're being attacked, which is unfortunate.
Working with Dr. Moline, we were at a meeting with all the neurosurgeons, and they were all talking about how great they were. And he got finished, they finished and they left. And he says, what do you think about the meeting? And I, I didn't want to say anything. He says, you see how narcissistic they are? And I said, yeah, I didn't want to say that. He says, that's because they're insecure. And that's why you never stop learning, even as a neurosurgeon.
Yeah, even if you get degrees, even if you get a doctorate, like stay open to what else is possible, because the universe and the earth has so much for humans to still learn about.
We're only using 5% of our brain. What does that tell you? It starts at the armpit. I found out by doing thermography when we were working with a clinic that we were doing thermography and we were doing the Oligoscan. And I started to see some patterns with the thermography. I said on the questionnaires, make sure you tell me whether they've had COVID or not. And I started to see the issue here, retention of the COVID. And so we found out that if we worked from the armpit, we could go up through the subclavian here, where, we make sure that wasn't blocked, go up the neck, past the back of the jaw, up into the cheek, and even up here, we could drain the sinuses. And so they would get rid of their eye pressure problem, and they would get rid of the sinus problem that is very common with post-COVID, because people were telling me, hey, I went to the ophthalmologist, they didn't find anything. Ears, nose, and throat people, they want to do an operation. A lot of people had operations for polyps or whatever, and there was nothing there. I know topically we could clear people of the post-COVID and the fog brain. And it's all a lot of times, take the earring off, get rid of the antiperspirants, and work up and do a cleansing, and the problem solved. Salt gets under the skin. That's just an explanation. If sodium storage is a disease, in other words, in the skin, the salts, we will need to focus on preventing sodium storage in tissue, or facilitating sodium removing from tissue, or on both. In other words, the skin is really important where all the salts, because they need to sweat out. And as we age, we don't sweat. But as we're going to see in the Oligoscan, that's where a lot of the aluminum hides. And aluminum in the armpit is used as an antiperspirant, but in the skin, it creates the same problem. And nobody's been able to figure that out. Oligoscan, I figured that out, and that a lot of the sodium mixes in with the aluminum mixes in with the sodium, and people tell me, well, I don't perspire anymore.
If you're interested in how the Herbalix products can help you, use this promotion code NumaThrive20 when you're checking out any product on the Herbalix website, and you'll get a discount. We'll see you in the next video. Go to our link tree, choose a free 10-minute call, select the day and the time that you prefer to learn more how this fast, non-invasive scan can help you up-level your awareness and improve your life through improving your health.